My name is Elizabeth Bayliss. I'm the Executive Director of Social Action for Health, which is a community development charity working in East London. We work on health inequalities, trying to reduce health inequalities and increase people's ability to speak up and take more control over their own lives. This series of events, as we called Tell Us About It, and the aim was to find out from local people in Redbridge what their stories around their health were, what their experiences of health services were, what their own experiences of managing their own health were. And we were invited to do this by the Primary Care Trust, who felt that they really didn't know how to hear from local people and how to hear their stories. The Primary Care Trust asked us to find out what local people wanted.
I think they should have more walk-in centres and easier access to emergency care.
Well, yes, it would be lovely to have, from my point of view, a diabetic clinic much closer to home.
Well, I think the waiting lists are pretty long at the hospitals, and sometimes they make mistakes with the appointment system.
And so we agreed that we would run a series of events where we would find people's stories. And so the first one was the 18th of May, where we had lots of people had tape recorders, our health guides, and people who were here gathering people's stories. And they used tape recorders, they had notebooks, we had graffiti walls where people put their comments. We had the video where people told their stories. We had some forum theatre where people actually told their story through theatre, which is a sort of safe space where people are not confrontational with service providers, but just telling their story in a way that everybody can hear.
Knock, knock. Knock, knock.
Come in.
Good morning, doctor. Good morning, doctor.
Morning.
Can I sit down? Doctor, it's 2-3 days ago, I got a really bad headache, and I take paracetamol. Does not work for me.
Okay, I'll write down you some tablets, get it from the chemist. Take one in the morning and one in the evening.
And I need to check out for me.
You don't need any checkup. You just take these tablets, one in the morning, one in the evening.
I'm Conor Burke and I'm the Director of Strategy and Organisational Development at Redbridge Primary Care Trust, or PCT. The PCT has a number of roles. I guess the two main roles are the first one is to purchase or commission services on behalf of the public, having identified what the health needs are. Then it goes away and actually buys those health services, whether they're hospitals, whether they're community services, or whether they're primary care services like general practitioners, dentists, pharmacists. So it makes sure that the healthcare needs of the general population, the local population, Redbridge, are met. The second main role of the PCT is to provide some of those services, having identified the needs. We've been conducting a number of listening events over the last 6 weeks to really better understand what people want from the services that we're buying for them.
What I want to talk about is cancelled appointments. You know, you go to a doctor or hospital, you travel, you have go by 2 buses or take taxi or go for miles and miles. When you go there and you're told your appointment has been cancelled, nobody informs you. That's also a really matter we have to consider.
We've not worked in Redbridge before, so we didn't know whether we would be able to work to get the local people in. We know we can do it in other boroughs because we worked there a long time. We haven't got the roots here in Redbridge, so we weren't sure we would, but we're very pleased with how many people have taken part. It's a very interesting result, though, from today, and different from any in other boroughs. If we were doing this exercise in Hackney or Newham or Tower Hamlets, we would have not had the sort of nature of comment overall that we've had today.
I have lived in this world 47 years and I've seen the changes. The hospitals which have closed down, Barking, even the maternity when it was built and then closed down. What the gentleman said about the population is correct. I'm also a trustee of age concern. At the end of the day, this borough has taken a wide population of people coming from all over the world. Yep. Compared to what we had. And at the end of the day, we got to realize that we haven't got sufficient doctors to cope with some of the things that are going on. The centers which have opened, the clinics, they do quite well. There's a lot going on at the clinics. And if you've got a very good GP, he has a lot of services put in his own service.
What you've just said is true. Hospital beds are now getting fewer. But if that's the case, I presume then the outpatients, you're going to have more doctors. And I think the biggest problem that affects all of us is the blood department. Why are we having to wait 2 hours, standing up, and I go very often because I've got an illness, so I know that it's a 2-hour wait. When are you going to improve that department?
Well, it's another good question. And one of the things that we are doing this year is we're introducing a community blood service, and the technical term for that is phlebotomy, where we're going to get people to do much more blood testing within the community, so they don't have to go all the way to the hospital and sit for 2 or 3 hours in a sterile waiting room waiting to have blood taken. They can do it much more locally around their general practice. Now some of that will happen this year, and we'll be gradually hoping to increase that over the next few years.
Redbridge is not a borough that's used to consultation, and it's quite a tense borough. There's racial divides. There's a difference between in wealth that's very marked here. We have Redbridge is very, very rich and very, very poor. And the differential is larger than any other single borough in London, which is one of the reasons we were keen to come. And it showed up today. So we had people who are prosperous saying, you know, the NHS is fine, you know, we've got no complaints about it, and these people are all asylum seekers, and they, you know, what right have they got to services? And then you've got the people who can't speak English, feeling that they don't get a fair service. So there's some work to do on trying to marry this. In any other borough, we wouldn't have had this stark difference, and it reflects the borough, and it's a success that we have real authentic stuff coming out today. This is genuine. This is what we would expect from the demographic detail and everything. And here we have it shown that there is this marked distinction.
Have you ever been in pain? Did you ever cry all night? Did you ever feel afraid that nothing will ever be alright again? Have you ever been alone? Did you ever give up hope? 'Cause there's no one on the phone or at home, no one to help you cope. Doctor, here's my story. It's simple and it's plain. Doctor, don't ignore me. Listen while I explain. Na 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 na.
They treated me well. I felt like a queen.
The doctor said, if you don't like it, just go to another doctor.
You know what? GPs are out there to make money. They're not interested in patients.
I get anxious. Why can't they understand my situation?
My doctor doesn't listen to me.
There are good doctors and also there's good patients.
It's a laboratory. What luck?
When you get a good doctor, you're very lucky.
my story. It's simple and it's plain. Doctor, don't ignore me.